advised to take dental x-rays. But are you skeptical about it? Because you already know that x-rays are harmful for you. Hi, welcome back to my channel. So, whenever you visit a dentist, you must have noticed that they always ask you to take an x-ray, right? Like most of the time. But you already know that taking so many x-rays are not helpful for you. They are actually harmful because they are radiations and you are taught that you're supposed to avoid the radiations. Because of this, either you refuse to take an x-ray or you are always scared of the x-ray exposure that you're going to get. So do you really think it matters? Then imagine the dentist is in the clinic taking so many x-rays in a day, his assistants are present, everybody is getting exposed. So do you really think that it matters? Whenever your dentist takes your x-ray, they make sure that they take all the precautions necessary and they follow what is called as ALARA principle. ALARA just stands for as low as reasonably achievable. So we use the minimum exposure that is needed for us to get an x-ray which is good enough for us to interpret what is required. Along with that, we take an x-ray not just like that because every patient needs to get it done. That's not the case. We do it only when we feel that the benefits will outweigh the risks associated. So, whenever there is a problem, what we see on an outskirt may not be the real cause of the problem. So how the tooth is inside, how is the bone inside, if there is any cyst or if there is any sort of an infection which is present or anything that you want to see a bone loss. For all these, you need to take an x-ray. And what happens is if you don't take it at the right point of time, by the time which is something which is not clinically visible is what we are trying to look for in an x-ray. So by the time the same situation becomes clinically visible, the time may have passed that you may either not be able to save the tooth or what will happen is the treatment at that point of time will be much expensive for you. So ultimately, neither for the dentist nor for the patient, it is going to be beneficial. So taking an x-ray at the right point of time is so important so that we can have a treatment plan as well as we can do a treatment at the earliest condition. X-ray will help your dentist to have a treatment protocol for you based on the condition of your tooth. Like for example, if you have a very periodontally compromised tooth and you do a root canal, neither the doctor nor the patient will be in a situation that where you do the treatment and then you realize that this was not the right thing to do. Maybe this tooth is not going to survive for long. So you spend your entire amount on a treatment which was not at all required for a tooth which is not going to withstand that for long. So based on all these, you will be able to tell your patients, the patient will be able to understand whether something of this sort of treatment is going to be long lasting or is it, patient gets a choice whether this or that, which one do they prefer based on their financial condition. Now the science is so developed that nobody actually takes a traditional x-ray which has more exposure. The digital x-ray which we have in today's time, if you take the entire mouth, 18 to 20 photos will cover your entire tooth. And you even have different type of x-rays which will cover your entire mouth in one shot. So the exposure that you have because of that will be almost equivalent to, if you are walking under the sun, you watch TV, you are using your mobile phones, you are still under radiation, right? So those mild levels of radiation which you get from these things around, the dental x-rays is nothing much more than that. Isn't that interesting to know? So whenever your dentist is taking it, they also follow the basic precautions like you have the lead apron which they wear, then you have a thyroid collar for protecting your thyroid gland from the radiations. If your dentist is not providing you with that, now you know about these things, you can ask them to give you a collar, thyroid collar and lead apron before taking an x-ray. You must have also seen that just before clicking the x-ray button, after preparation of the film and everything, we dentist and the assistant, we just run away from that place. Now don't be scared that that's because we want to avoid the exposure. See, we are under a much more environmental risk because the entire day we spend there taking multiple x-rays in a day. So that's not concern to you. For you, it's just a single or maybe not more than 10 to 15 x-rays in a day, and that really doesn't matter. You must be also having a doubt, like when you go for an MRI scanning and all, they ask you to remove your jewelry, your specs, etc. So do that need to be done in case of a dental x-ray? No, we don't need to do that unless it's a bigger film x-ray, which we don't generally take it in a clinic. In that case, maybe you might have to remove your earrings or your jewelry. Otherwise, In a general setup, you don't need to remove any of those things, and neither your specs. As long as your specs doesn't come in the way of the X-ray which we want to take, it's all fine. You can be as cool as you go. There's no need of any nervousness before an X-ray. The only problem that some of the patients would be facing is gag. See, placing something not so big, but still it's a foreign body inside your mouth, and we try to, because we want to see the thing properly, we try to keep it more inside, more deeper inside your mouth, and that causes a little bit of uncomfortable situation for you. So what happens is, many patients do have gagging. Some of them don't develop gagging, but they are not comfortable in their chair. So what can you do about that? Just tell your dentist that you are not comfortable. So he will definitely give you some time to relax. You need to leave your muscles loose and relax and sit. When your muscles are loose, what happens is the film that is placed inside will easily go inside, and it stays in place, and you stay like that. It's just a second that it takes, for taking an X-ray. So that much of the time, you have to be first mentally prepared for it. If you are not comfortable, make sure that you tell it to your dentist. And if you're somebody who has a gagging issue, definitely mention it to them. They will take the necessary precautions that is required. Along with that, you can also ask for, as I before told, you can ask for all the precautions from your side so that you protect your thyroid gland, your reproductive gland, and everything. They will do it by themselves. So the next time you visit a dentist and they ask you to take an X-ray, just don't worry. Just be very cool and get an X-ray done. It is something which is very important. And even for a dentist, just looking something at the outskirt and then deciding what might be the problem inside and treating accordingly is not acceptable. So please do understand that we do it only when it is necessary. So that's all for today. See you in my next session. Please like, share and subscribe my channel and press the bell icon so that you don't miss out on these videos. Thank you.